Study Section 4. Principles guiding clinical psychology and functions. Introduction. In this lecture, you will be exposed to the major principle guiding training of clinical psychologists. Specifically, you will be expected to be able to differentiate the clinical scientist model from the professional model in training clinical psychologists. Finally, you will be introduced to major functions of clinical psychologists and the settings where they are carrying out their professional roles. At the end of this lecture, you should be able to 1. Know principles guiding training of clinical psychologists. 2. Differentiate two major models in training clinical psychologists. 3. Understand major functions of clinical psychologists and setting where they work. Pretest 1. Explain the experimental approach in clinical psychology. 2. How can you describe the training of clinical psychologists as a profession? Content. Emphasis has been on the dynamic diagnostic content. Principles guiding in clinical psychology. There are certain principles guiding the training of clinical psychologists. Emphasis has been on the dynamic diagnostic and experimental approach in training clinical psychologists. In the dynamic approach, psychological test data could be used to shed light on clinical adjustment with a view towards making recommendations and treatment plan that could be used by others. This suggests that the test data have been therapeutic implications. In the other hand, the experimental approach emphasizes verifying the scientific law whereby one scientifically tests for psychological implication of some conditions. In the training of a clinical psychologist, one can identify two independent models, the clinical scientist model and the professional model. Clinical psychologists are trained in the two models. The clinical scientist model. The model emphasizes experimental psychopathology, where training is conducted to determine the effect of certain conditions on development of psychological dysfunctions in an individual. Using this model, clinical psychologists are also trained as researchers, where they are exposed to the different characteristics of individuals, that is, personality, and how to measure them and understand how to discover new things in research. Clinical psychologists are often faced with assessment of individual traits, characteristics, ways of handling issues, nature-nurture controversy, and the question is on how to measure this aspect of the individual. When a clinical psychologist identifies personality of the individual, he will be in a position to predict the behavior of that person. I think a clinical scientist model of a clinical psychologist is best described as someone who does A. work exclusively in a university setting, B. works exclusively in a hospital, C. someone who teaches and works in a hospital. If you picked A, you're wrong. Why? Exclusive teaching is a scientist but not adding the clinical part. If you pick B, you are wrong. Why? Working only in the hospital is a clinical model while not adding the scientist component. If you pick C, you're right. Why? The clinical scientist model does research to understand behavior while understanding the psychotherapeutic basics of treatment. The professional model. The training of a clinical psychologist involves exposure to how to conduct therapy, assessments, diagnosis, and other professional practices. Basically, clinical psychology has the practical objectives of understanding, evaluating, controlling, and treating of psychological problems such as insomnia, depression, anxiety, etc., etc. There is organized body of members with approved qualifications. For example, the Nigeria Clinical Psychologists Association is only open to qualified clinical psychologists with at least master's degree in clinical psychology. There are specific rules and regulations guiding members of this professional body. Clinical psychology as a profession, there are clearly stated codes of ethics. For example, under no circumstances shall a clinical psychologist have carnal knowledge of his client who is currently under his treatment. It is appropriate to note here that the clinical psychologist remains one of the best trained professionals in the mental health professions when it comes to evaluation, assessment of instruments, intervention methods, and community or hospital programs. High TQ. The emphasis on the assessment, diagnosis, and practice will be more on the professional model than the clinical scientist model. Why? A. The training is focused more on basics of research writing. B. The training is focused on a theoretical knowledge and the tenets of treatment and diagnosis. If you picked A, you are wrong, because a clinical psychologist with only research writing will only be a scientist, while if you picked B, this is right because this is the core component of professional model. Function of clinical psychologists. Generally, the role of clinical psychologists is to assess and intervene in a wide range of problems where they have special expertise. The range of problems they deal with covers psychological conditions such as anxiety disorders, problems of disturbed and disruptive behavior, everyday challenges and disorders of mental processes, among others. In all these cases, the psychologist is trying to understand or change an essentially psychological problem of an individual, family, or group. Summarily, clinical psychologists are involved with an issue which does not primarily relate to identified patients but affect the healthcare system as a whole. For example, a clinical psychologist may educate the community members on the ripple effects of vandalizing petroleum pipes, emphasizing its direct danger in an individual, community, members at large. How can community health center design education program that will deter potential vandalizers from acting out their own intention and become a peer educator to others? Other notable functions of clinical psychologists are discussed below. Clinical assessments and intervention. Clinical psychologists assess clients' psychological and social problems, limitations, and capabilities. There are perhaps many ways of formally defining psychological assessment. Clinical assessment involves evaluation of an individual strengths and weaknesses, a conceptualization of the problem at hand, and other prescription for alleviating the problem. Assessment is not something that is done once and then forever finished. In many cases, it is an ongoing process in psychotherapy. It is the means to the end for the clinicians. Before a clinical psychologist engages in therapy, he needs to understand the nature of the problem. In assessment, a common question that a clinical psychologist asks is, how is this patient or client functioning psychologically? For example, in a case of drug addict who is presenting withdrawal problem, the psychologist observes the symptoms of withdrawal, and secondly, the clinical psychologist identify the aspect of the environment such as stressful conditions at home, peer pressure, and so on that predispose the individual to taking drugs. Furthermore, the psychologist identifies the cues within the environment that maintains the dysfunctional behavior, that is, drug-taking behavior such as smoking of cannabis, igbo, around the client's residence, and at the end of the evaluation, the clinical psychologist draws up a treatment program that will be best suited for that particular case of drug addiction. Psychological intervention is a method of inducing changes in a person's behavior, thoughts, or feelings. Therapeutic approaches of the clinical psychologist differ from that of the medical doctor. The medical doctor uses chemotherapy and surgery, while clinical psychologist uses psychotherapy, psychological therapy. In treating clients, during psychotherapy, the psychologist establishes a genuine relationship with the client. The therapist and the client work together as a team in order to resolve the client's psychological problem. In some cases, therapy is undertaken to solve a specific problem or improve the individual's capacity to deal with existing behaviors, feelings, or thoughts that are debilitating. In other cases, psychotherapy may be focused more on the prevention of problems than on remedying an existing condition. In still other instances, the focus of therapy is on increasing the person's ability to take pleasure in life or to achieve some latent potential. ITQ. One of these is the appropriate sequence in any psychological intervention. A. Assessment, case formulation, treatment. B. Case formulation, treatment, assessment. C. Treatment, assessment, case formulation. If you have picked B or C, you're wrong, because assessment is the first step in creating knowledge about client's problem. With case formulation, understand what keeps the problem, and before understanding the best form or forms of treatment of the illness. Consultation. Clinical psychologists can act as consultants by offering guidance to both laypersons and human organizations. The role of the consultant is to guide consultees towards creating their own improvement in the groups or organizations they represent. For example, clinical psychologists can act as a consultant to a teacher in a school setting. In this regard, the clinical psychologists provide the teacher with the best assessment tools that fit a particular student. A typical clinical psychologist can function as a consultant to a community mental health center and at the same time in working on a part-time basis for psychological consulting firm to and also consult with local chapter of self-help groups such as the Alcoholic Anonymous group, helping individuals with alcoholic problem. Administration. Some clinical psychologists can serve as executives, managers, or lecturers in organizations such as the University of Psychology Department. An administrator guides and controls the effort of a group towards some common goals through the use of skills in planning, organizing, assembling resources, directing, and controlling. Clinical psychologist is competent in assessment, therapy, teaching, and consultation. For this reason, is better equipped with the tools of administrative duties. Research. This is a very dynamic and vital aspect of all forms of human endeavors. Clinical psychologists undertake research investigations that lead to new discoveries daily. Research can also be directed at examining causes and consequences of psychological dysfunctions. For example, the role of negative life on psychological functioning of one of the clinical psychology students. The clinicians may be interested in the cause of high admission rate at health center just before examinations. A clinical psychologist may also be interested in the study of relapse, identifying the psychosocial factors responsible for the relapse of a particular psychological disorder. Settings where clinical psychologists functions. Clinical psychologists carry out their scientific and professional work in many settings. Clinical psychologists work in a wide variety of settings. This includes hospitals, mental health clinics, schools, universities, government agencies, prisons, police departments. Many clinical psychologists also work in private practice. Summary. This lecture explained the principles guiding clinical psychology as a profession. The general function of the clinical psychology is to assess and intervene in a wide range of problems where they have special expertise. However, other major classified functions of the clinical psychologist are clinical assessment and interventions, consultations, research, and administration. Finally, settings where clinical psychologists could be found include hospitals, mental health clinics, schools, universities, governmental agencies, prisons, police departments, among others. End of study session 4. Thank you for listening.